Recording. So hello again and welcome to classes. This is week number 6. And in week number 6, we are only having classes by Zoom, not híbridas, because you told me that last week that in this week, today you don't have any other face-to-face classes or meetings. So for your comfort, I decided to only do the class online. But this is an exception. From next week, we continue with the hybrid classes, okay? With the hybrid classes. So that's it, right? Today's topic, or this week's topic, is medical tools. In Spanish, herramientas médicas. It's very interesting because we're going to talk about those elements, those tools that you usually use in your profession when you are doctors, when you are revising and checking your patients. So we have a number of activities that I published on uCursos, on a Word document. And from those activities, in this class, we're going to do 2 or 3, no more. And the rest of the activities that we don't do now in classes are the complementary activities for this week, online activities, okay? So that is the deal. And apart from that, if you check the syllabus for week number 6, we have the reading activity. This week, which accounts for 15% of your final mark. So we are going to work first on medical tools, and by the end of the class, I'm going to give you the instructions for our reading activity that you are going to do during the week and that you have to send to me by mail. Okay, so this is a plan for today. Medical tools and instructions for the reading activity, evaluated reading activity. Okay, hello Erasmo, how are you? Hello Romina, how are you?
Hello, fine.
Great. And you, Erasmo? No, no Erasmo. Okay. Ahí estás en el chat. That's good to know. It's good to know you're fine. So we are working on medical tools. Let me show you the first activity. I'm going to show you a video. Okay. We're going to begin with a video of medical tools. You're going to watch and listen to the video, and you're going to answer this question. Let me write the question in the chat. What are the medical tools that what are the medical tools mentioned by the vet? Esa es la pregunta. You're going to watch and listen to this video and you're going to answer that question. What are the medical tools mentioned in the video by this vet? Okay? So let's watch the video together. Where is the video? You are watching my WhatsApp. Let me catch the video here. Are you ready? Here we go.
So we are checking his liver and his spleen and all of his abdominal organs to make sure that he does not have cancer. This is our liver. We're going to take a quick picture of this thing so we'll have it in record. Some of the tools that veterinarians use revolve around the same types of tools that are used in human medicine. We use stethoscopes a lot. So there are a lot of things you can determine with an animal when using a stethoscope. Listening to their lungs, listening to their heart, listening to their abdomen. That can give you a great deal of information. We use lots and lots of books. Veterinary medicine is very, very detailed. We have much knowledge about animals and their diseases. And so there is a lot of book learning and a lot of continued book learning. Probably one of the most important pieces of tools that we use would be the pen. And that's because we document every single thing that we do from a day-to-day basis with a case, because this is a medical case. And these patients in veterinary medicine, just like in human medicine, have medical charts that we keep up with. We also use a lot of surgical instruments, such as scalpels and hemostats and things like that on a day-to-day basis. So it revolves around medical tools. So we are.
All right, my friends. So what is the first element that the doctor mentions in the video? You can use a microphone or the chat. Okay, I'm going to play it again, and you are going to tell me.
Checking his liver and his spleen and all of his abdominal organs to make sure that he does not have cancer. This is our liver. We're going to take a quick picture of this thing so we'll have it in record. Some of the tools that veterinarians use revolve around the same types of tools that are used in human medicine. We use stethoscopes a lot. So there are a lot of things you can determine with an animal when using a stethoscope.
Okay, what is the first?
Listening to their lungs,
Guys, are you there? So what is the first medical tool that he mentioned?
But I don't understand. ¿Qué dice?
In Spanish?
¿Ah?
In Spanish?
The video I don't understand.
Okay, so let me repeat.
Profe, si le pone
Types of tools veterinarians use revolve around the same types of tools that are used in human medicine. We use stethoscopes a lot.
Okay, Erasmo, very good.
Ahí sí lo escuché.
The first one is a stethoscope, okay? Can you say that? Stethoscope. Thank you, stethoscope. And what can you do with a stethoscope? Let's continue.
So there are a lot of things you can determine with an animal when using a stethoscope. Listening to their lungs, listening to their heart, listening to their abdomen. That can give you a great deal of information.
So what can you do using a stethoscope?
¿Podría repetir esa parte, por favor?
Oh, yes.
When using a stethoscope, listening to their lungs, listening to their heart, listening to their abdomen.
Escuchar el corazón, al menos lo que yo entendí.
También.
Yes.
Sé lo que hace el estetoscopio, pero lo que le
can,
entendí yo.
Very good, Erasmo. You can listen. You can listen to the heart You can listen to the lungs. You can listen to the abdomen, etc. Okay, so the stethoscope is very, very important because you can listen to the body, to the organs of the animal, of your patient, the heart, the lungs, the abdomen, etc. And with that, you can obtain a lot of information about the health, about the condition, about the physical condition of your patient. It's very, very important. Maybe, in my opinion, I don't know very much about medicine, but maybe it's one of the most important medical tools you have, the stethoscope, right? So let's continue. Try to listen to the second element, the second tool.
Part, listening to their abdomen. That can give you a great deal of information. We use lots and lots of books. Veterinary medicine is very, very detailed. We have much knowledge about animals and their diseases. And so there is a lot of book learning and a lot of continued book learning.
So what is the second tool? Is it really a medical tool or not?
Yo escuché libros.
Yeah, books, right. Very good, Yusuf. So that is the second tool, books. Isn't it surprising for you?
¿Cómo?
¿Le sorprende? Isn't it surprising for you? That the book-
No, no me sorprende.
It's not surprising because you
No.
have to read a lot, right? You need to read a lot because veterinary medicine has a lot of information. So you not only have medical tools, typical medical tools, but also you have books, which are a very important element for your learning. Let's continue listening to and try to listen for element medical tool number 3.
A lot of continued book learning. Probably one of the most important pieces of tools that we use would be the pen. And that's because we document every single thing that we do from a day-to-day basis with a case because it.
What is the next element, the next tool?
Pen.
Absolutely. Isn't it surprising for you?
No.
No sé, yo
It's
no
not-
consideraba algo obvio.
Yeah, it's something obvious. Yeah, it's something obvious, but it's a very important tool. It's not a medical tool, really. It's more of a general tool, but it's true. You always use a pen because with a pen, you document everything. You document everything and you have to write medical charts. You have to write medical charts, que son las fichas médicas. So it's very important for you to write the medical charts with the information of all the animals you treat. Okay, let's continue.
This is a medical case, and these patients in veterinary medicine, just like in human medicine, have medical charts that we keep up with. We also use a lot of surgical instruments, such as scalpels and hemostats and things like that on a day-to-day basis. So it revolves around medical tools.
And finally, he mentions 2.
Escalpelo y el otro no lo escuché.
Yeah.
Scalpels and hemostats, and we also use a lot of surgical instruments such as scalpels and hemostats. And
Very good. Those are 2 elements, and these are surgical tools, surgical instruments. Surgical tools are herramientas quirúrgicas. The tools that you use to perform surgical tools are used to perform surgery, cirugía. So the surgical tools are used to perform surgery. And he mentions two, Joseph. What surgical tools he mentions? Okay,
El-
good.
¿Qué es hemostat?
Hemostat, very good, Erasmo. It's
¿Es
okay.
anestesia?
El hemostat es el hemostato, que son unas pinzas. Son unas pinzas parecidas a las tijeras que son para agarrar venitas. Y
Ya.
si tú lo analizas etimológicamente, se llaman detiene sangre. Hemostat, que paraliza la sangre. Ya son pinzas quirúrgicas.
Ya sé cuáles son entonces.
Hemostats,
Ya.
and the other is
El
scalpel.
escalpelo.
Yeah, scalpels. Los bisturí, ¿no es cierto? Escalpelo. So maybe the hemostat and the scalpels maybe are the most typical and the most common surgical tools that you use to perform surgery, right? You have many, many others, but with the hemostat and scalpels, you always perform surgery, always, because you have to cortar, and because you have to stop the blood. So they are very important. And that's it. That is the video, okay? Now I'm going to, lo voy a tocar de nuevo el video para que ustedes lo escuchen y esta vez ya lo puedan disfrutar un poco, porque ya tienen las respuestas. Vamos de nuevo con el video. Voy a poner el texto también, ¿ya? Vamos.
So we are checking his liver and his spleen and all of his abdominal organs to make sure that he does not have cancer. This is our liver. We're going to take a quick picture of this thing so we'll have it in record. Some of the tools that veterinarians use revolve around the same types of tools that are used in human medicine. We use stethoscopes a lot. There are a lot of things you can determine with an animal when using a stethoscope. Listening to their lungs, listening to their heart, listening to their abdomen. That can give you a great deal of information. We use lots and lots of books. Veterinary medicine is very, very detailed. We have much knowledge about animals and their diseases. And so there is a lot of book learning and a lot of continued book learning. Probably one of the most important pieces of tools that we use would be the pen. And that's because we document every single thing that we do from a day-to-day basis with a case, because this is a medical case. And these patients in veterinary medicine, just like in human medicine, have charts medical charts that we keep up with. We also use a lot of surgical instruments, such as scalpels and hemostats and things like that on a day-to-day basis. So it revolves around medical tools. So we are...
Okay. So that is the first activity. It's a video introducing the topic of medical tools. Do you have any specific questions now before we continue with the next activity?
Yes.
Yes? No questions, Joseph?
No questions.
Okay, perfect. Perfect. So let's continue with the next activity. I'm going to show you a picture. And we're going to play a game. But let me show you the picture first. With more medical tools. Here we are. So this is a chart with more medical tools. We have 1, 2, 3, 4, 1, 2, 3, 4, 5, 6, 7, 28 tools that are usually used in medicine. Maybe in human or animal medicine, it's kind of similar, right? So what about the first? Can you repeat after me? Stethoscope. A ver, Joseph, dale, stethoscope.
Stethoscope.
Okay. Joseph, do you have one stethoscope?
Yes.
You have one? Okay.
I
And
use in the. ¿Cómo pronuncio fisiología?
physiology.
Physiology.
And tell me, este es el juego, esta es la pregunta que van a responder para todos estos elementos. Esta es la práctica importante, aparte de la palabrita. What do you use, en este caso el estetoscopio, the stethoscope for? Joseph, what do you use the stethoscope for?
For listen the rhythmical heart.
For listening, yeah. For listening to the heart, to the abdomen, to the lungs, etc. Right? It's one of the most important tools, medical tools. When you listen to the body, you can obtain, you are as experts in medicine, with the different sounds that the body makes, you can determine a lot of stuff, a lot of things, you know, only by listening to the body. You can know if the person is healthy or unhealthy. You can know if the person or if the animal in this case has this or that problem. Okay, what about the next? Can you repeat after me? Scissor.
Scissor.
Very good. Milenka. Scissors.
Scissors.
Usualmente se ocupan en plural, con ese, ¿no es cierto? Tijeras, scissors. Tell me, what do you use the scissors for?
Si yo he ocupado,
No, ¿para qué? La misma pregunta que vamos a responder para todos los elementos, la misma pregunta, ¿ya? ¿Para qué? What do you use the scissors for in general terms?
I don't know.
For cutting, my darling. For cutting something, right? So the scissors are used for cutting elements, whatever. In the case of a surgical procedure, maybe you cut la carne, the flesh, but you can cut whatever you want. You can cut paper, you can cut many things. In the case of medicine, you can use it for many, many things. Constanza, stretcher.
Stretcher.
What do you use the stretcher for?
Transport.
Yeah, for transport. Excellent. Erasmo, weighing scale. What do you use a weighing scale for?
To weigh things.
To weigh things. Así se escribe, para pesar. To weigh things, absolutely, yes. You can weigh people, you can weigh animals, you can weigh whatever you want. Excellent. Joseph, what is the next element? Can you repeat here? Arribita, me salté uno. Magnifier.
Magnifier.
What do you use a magnifier for?
See.
Yeah, to observe and to make things bigger. With the magnifier, you make things bigger. They are more gigantic, okay? So that is the use of a magnifier. What about, well, the torch is very boring. What about the face mask? So popular now with the pandemic. Constanza, what do you use face mask for?
For not contaminating the area.
Very good. For not contaminating the area. Yeah. Excellent. Pucha que estoy escribiendo mal. Es con G, contaminating, no con F. For not contaminating the area. Yeah, for stopping the spread of viruses and germs. For stopping the spread of viruses and germs, you use a mask. I don't know what this is. A tuning fork. What about this, Milenka? Can you say that? First aid kit.
First aid kit.
So what do you use a first aid kit for?
For emergency.
Yes, for emergencies.
Heridas pequeñas, no sé cómo decir.
Small,
Lesiones.
yeah, for small wounds.
For small.
Heridas, for small wounds and for emergencies. Very good. For small injuries también. Ahí denote. Lesiones, heridas, wounds, injuries. It's a kit that we use for emergencies, for small problems, small injuries, small wounds, small accidents. Yeah. What about this, Erasmo? Gauze. Gauze. What the hell is that?
To protect an area that is wound, like or clean the area that is wound as well.
Yeah, I like it. To protect the area that is hurt or wounded. Sin acento. To protect the area that is hurt or wounded. Para proteger la zona que está herida o herida. To protect the area that is hurt, that is wounded. Yeah. Also to clean or to keep it clean. Very good. We use the gauze on top of the wound, on top of the skin, and with that gauze, we protect the wound. We protect the injury. Okay, excellent. What about this, Joseph? Can you say that? Rubber gloves.
Rubber gloves.
What do we use a rubber gloves for?
Don't contaminate the patient and me.
Okay. Not to contaminate the patients. Can you say that? Patients or myself? Joseph? Patients.
Patients.
Yeah. Not to contaminate the patients or myself, not to contaminate the medical tools, right?
Yes.
So to protect myself, the patient, and the objects from contamination. Constanza, scalpel.
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 For cut.
We use a scalpel, yeah, we use a scalpel to cut. Constanza, do you like cutting?
I don't know.
It's very good. Now, yeah, to make these incisions in the flesh and then perform the operations. That must be a very weird sensation. Okay, anyways, what about the ambulance, Milenka? What do we use an ambulance for?
Ambulance. For transport.
For transport, excellent. With the ambulance, we can transport patients to the hospital or to the house, especially in emergencies. It's very important. The tweezers are pinzas, tweezers. Erasmo, what about the microscope? Microscope.
To use to analyze very small things.
Yes. To observe and analyze very small things. The microscope is very similar to a magnifier. We use it to make things bigger, right? Joseph, can you say this? Otoscope.
Otoscope.
Otoscope. What is the use of the otoscope?
I see. ¿Cómo diría canal auditivo?
Okay. ¿Lo ven? El otoscopo sirve para mostrarlo visualmente. Perdón mi
Más bien
inglés.
para iluminarlo.
Ah, yeah. Okay, to illuminate the hearing canal. Yes.
Ah, ya.
To observe, to analyze the ears. Okay. So we use the otoscope to check the ears, right? And to check our hearing organs. Hearing organs. Excellent. What about el famoso? This is one of the most typical and important elements in every house, you know? Everybody in the house has one, can you say after me? Thermometer.
Thermometer.
Thermometer. What is the use of the thermometer?
To see body temperature.
Yeah. To check, to measure. Medir, to measure the temperature, the body temperature. Very important. To measure, to check the body temperature. Yes. What is a normal temperature in dogs? Enséñeme algo. What is the normal temperature in dogs? What is the normal temperature in cats? I don't know.
I don't know, profe.
A decir verdad, tampoco sé.
Oh my
¿Dependerá de la
God.
especie?
Oh my
¿Dependerá de
God.
la especie?
No tengo idea, my friends. I don't know. Okay, that is homework. It's very important to know that. I know that the normal temperature in humans is about 36 degrees Celsius, or 37 maybe, but for animals, I don't have an idea. What about X-ray? Erasmo, what is the use of the X-ray? What can we do with the X-ray?
I don't really know how to describe it.
And in
but
Spanish?
it's like to see bones and things that are inside of
Yeah,
the body of a patient.
eso es. That's it. Perfect. We can see the internal organs, the internal structure of the patient. So we can see the internal structure, the organs, the bones, the heart, etc. Absolutely. What about the next? Can you say that? Saline. Saline. Bolsita de salina. Saline bag. Es el suero. El suero, yeah? What is the use of the saline bag? Milenka.
Administrar, no sé cómo decirlo, como ingresar,
To administer.
ser saline patient,
To administer.
patient.
Repete.
Checking his, yeah,
Checking his. Serum. To administer serum, suero, or to administer saline solution. Okay. Then we have,
Creo que también funciona como sustituto de la sangre.
What about the syringe, Joseph? Can you say that? Syringe.
Inject medicament.
It's used to inject medicine. To inject medicine. Yes. To inject fluids. And we also use the syringe to extract. You can inject and you can also extract, which is a kind of opposite movement. Fluids, right?
Yes.
Yes. What about the medical chair, Constanza? Medical chair.
Medical chair.
What is the use?
To examine.
Yeah, exactly. To examine patients. To examine. Can you say that? Examine.
Examine.
Examine. To examine patients. Then we have pills. Píldoras. Medicina. Pills. Then we have the cane. In Spanish, ¿cómo se llama esta cosita? I don't know. The cane.
¿Será como un bastón? No sé.
Es un tipo de bastón
buscarlo.
particular, ¿no es cierto? Es un tipo de bastón particular. Cane, yes. And then we have the wheelchair here. What is the use of the wheelchair?
Help to ¿cómo diría? Help to transport the patient.
Yeah, absolutely. The wheelchair is used It's helpful to transport patients, yeah. Especially those people who cannot walk, who cannot move because of an accident or because of a broken leg or whatever, right? And then we have el guatero, the hot water bag, the bandage. Ahí le falta una E al final, bandage, un curita, bandage, con E al final. A bandage that is used to protect injuries and wounds. The crutches that are used to walk. And this is ointment. Can you say that? Ointment.
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 Eso sería como
¿Qué es?
cualquier cosa que sea una cremita. Es un
Ah,
ungüento. Y ahí puede ser cualquier cosa. Hay miles de tipos de cremitas para miles de usos. En general son para la piel, ¿no es cierto? But you have a lot of ointments. But the general word is ointment. That you apply on the skin, usually, okay? For many purposes, many different things. So that's it, you know, you have a nice picture with very typical medical tools. And thank you very much. We spoke in English a lot and we practiced how to describe the use of all these medical tools. So very good practice. Do you have any particular questions before we continue?
not questions.
There are no questions? Okay. So let's continue with the next activity. I'm going to show you okay, this is the Word document that I published on uCursos for week number 6. We did this now and we did this now. So the rest, el resto, activities 3, 4, and 5, you are going to do online, okay? As complementary activities, individual activities for exercising more in connection with the topic of medical tools, okay? You have a video with vocabulary with 100 medical tools. So in this video, you have an expansion of many other medical tools. Very interesting. Then you're going to go to Wikipedia for activity 4. And here you're going to learn about more instruments used in medicine with pictures and definitions. Very simple definitions. The definitions are similar to the definitions we made in a few minutes ago. Very simple. And finally, you have a quiz, a picture quiz. You're going to go here and check how much you understand, how much you know about medical tools. Okay? Ese va a ser como el quiz para saber qué tanto pudieron lograr conocer y aprender de este tema. Yeah? So 3, 4, and 5 are the online activities. And now I'm going to explain to you the evaluated reading activity for this week. In the semester, you only have one evaluated reading activity, and in week number 6 is the time for this activity. So let me show you and explain to you what you have to do. Deme un segundito, ¿ya? Tengo que salirme de acá. Al tiro voy, al tiro voy, al tiro voy. So, esto es 1. Esto es 2. Ya. Okay. En Ucursos, you have all the materials for the evaluated reading activity. Acá tienen, in a Word document, you have the instructions. Aquí me lo repetí, pero solamente está publicado una vez. Then you have the audio for this activity, and then you have the book for this activity. So what is the idea? For this activity, you are going to read and you're going to listen to this book at the same time. You're going to read and listen to the book at the same time. And then when you finish, you're going to answer some exercises. So it's a different activity because you will listen and you will read all together. Okay? So I'm going to show you the book. A ver si puedo lograr que lo escuchen. Voy a tratar de hacer eso. No estoy seguro que si lo puedo mostrar, de lo contrario lo hacen ustedes. Pero esa es la idea. Yo les subí el material en audio y en PDF. Entonces quiero que lean y escuchen este librito a la vez. Y después hagan los ejercicios. ¿Por qué? Porque al escuchar van ganando más aprendizaje en términos de la pronunciación, ¿no es cierto? A ver. This is a book that you're going to read and listen. The name is Animal Life Cycles, and it's a special book for students of English. It's not very difficult. It's a simple book, okay? And it's about animal life cycles, so the topic is connected to your career, to your area. Let me show you the book very quickly. Here you have the index with different chapters, life cycles, insects, other invertebrates, fish, amphibians, reptiles, birds, mammals. And then here on page 36, we have the activities, right? Let me show you very quickly. Ya, van a ir entonces leyendo y escuchando, capítulo por capítulo. Les voy a subir el audio de cada hoja, ¿ya? Por favor. So you go reading about life cycles, about insects, about other invertebrates, for example, earthworms, octopuses, spiders, lobsters. Then you're going to read about fish, about the eggs, young fish, growing up, the breeding of fish, amphibians, about the metamorphosis of amphibians, the eggs and larvae, when they become, the cycle to become adults and the breeding, about reptiles with the eggs growing up, the breeding and keeping safe, birds, courtship, nests, eggs, chicks and growing up, mammals, breeding, having babies, baby mammals, life cycles, marsupials. And then on page 36, we have the activities. Important. No van a hacer todas las actividades. Por cada capítulo, del 1 al 8, lo que yo hice fue escoger una de estas varias actividades. Entonces en el capítulo 1 van a hacer una actividad, en el 2 otra, en el 3 otra, y así sucesivamente. Y me las van a mandar De aquí al, creo que es al miércoles que viene, ahí voy a chequear, por correo, ¿ya? En una hojita, un documento Word, me mandan todas las respuestas. Déjeme mostrarle entonces el documento Word. Y este es el documento Word. Reading Activity, Audiobook, Animal Life Cycles. Deadline, May 4th, 8 p.m. Hasta el 4 de mayo. Eso es el próximo miércoles a las 8 p.m. Tienen 8 días. You have to send your answers to my mail with the subject Reading Activity and your name and last name. Reading Activity, Juanito Pérez. And these are the specific instructions. Read and listen to the book carefully. And then you answer these activities that start on page 36. For chapter 1, only activity 4 on page 37. For chapter 2, activity 1. Aquí les voy indicando el número de la actividad por capítulo. Es solamente una por capítulo. En total son 8 actividades. And that's all. Pero insisto, very important. You have to read and listen to the book. Please. Those are the instructions. Now, before we finish, I want to check if you have any questions, people. Do you have any questions?
No.
Okay. Erasmo, Constanza, Milenka. Do you have
No.
any questions?
No.
No, teacher.
Okay. Excellent. So that is all for today. Do the activities 3, 4, and 5 about medical tools and do the reading activity. And remember to send it to me before 8 o'clock of May 4. That's all. Thank you very much. Take care with the rain. Okay, be careful with the rain.
Goodbye.
No se mojen las patitas. Bye bye. Take care.
Bye.
Bye.